Hello, welcome, dear friends of homeopathy, and welcome, Mahesh. I was really looking forward to this interview because we know each other now quite well. For sure, more than 25 years, 20 years, maybe 25. And we
Yes.
started to cooperate because in this time I had a lot of psychiatric patients and I was really totally helpless. And through your teachings and lectures and work, I'm really, how do you say, I'm not afraid if somebody comes with no matter what psychiatric disease. So I'm very grateful for this, and many people are this. So now I just want to do a very short introduction about your background so the people know where you come from. You were the head of a psychiatric department in a hospital in Mumbai and prescribing allopathic remedies.
Yes.
And you also wrote a textbook for students. So all the clinical part. So your background is really clinical. So you know about, you're talking about what is happening in psychiatry, everything. So from this, I would like, what I know is that then on a sudden you found out that you want to change your kind of work, and then you met Rajan, the sensation method. So I want to ask you, maybe from this time, you just tell us some points. And also what I would like to know, and remember when you started with this concept of Freud, of the ego, the id, the super ego, because this was the base of everything, how we could understand ourselves and the human. So I think it would be interesting for the listeners to get some of these ideas, who we are and what is the ego and so on. Please.
So first is that let's talk about psychiatry. Psychiatry began with Freud and his contemporaries, and they came up with psychoanalytical theories. Whole idea is what is going on in your unconscious mind, how you produce defenses, what are your complexes within your mind, and also certain life states where certain traumas can crystallize, like in the oral stage, anal stage, and whatever. And then we have Eric Erikson, which told how one person is at every age. So it was very psychologically minded. But the problem was then what to do with all this wonderful information. So the only option was that we do psychoanalysis, psychotherapy. But it takes a long time and it works mainly at the mental level. And when patients came with schizophrenia, depression, anxiety, people don't have time to just sit on the couch and go on telling. And at the end of it, the results were not there. So though the theories were good, they were not practical. So finally, they started leaving it. And in 1950s, they came up with chlorpromazine, the first antipsychotic drugs. And then was a beginning. So the psychiatry, the whole thing became biological psychiatry. And so they divorce themselves from psychoanalysis or understanding a human being and all the psychodynamics that are going on. And this was very unfortunate. So by the time when I joined psychiatry thinking that I'll learn all these techniques and know about the mind and I'll be little. But there you go, there are 4 medicines and 4 illnesses and which drug to give where. And everything was all to do with the neurotransmitters. So it became very mechanical. So this was the beginning. So I then too read all those Freudian. They hardly read. Hardly it is even asked in examinations because it's all redundant for them. So what I found was all those theories were redundant for the allopaths, for the modern system. But all that can be used in homeopathy. So what was missing? So what they had thrown out, I thought it was very valid and very important. All that information I could use for finding a remedy. So that link, the whole thing that psychological theories and all this understanding of human, how they function and how we develop at every age, all that knowledge I thought was important. So like simple thing like Freud began with telling that, we have a conscious mind and unconscious. Unconscious is almost 90% of our being. we are governed not by our conscious, but by our unconscious. Even our activities, no? I'm talking, we are doing this. This is hardly anything. Imagine all the food we take, how it is digested, everything is unconscious. Our automatic systems are much more. And so understanding our remedy is in the unconscious. If we believe, if we follow as Rajan Shankaran has told us, that, we all have our individual script, which we call as the other song, which is inside us. And it is made in such a way that we are not aware. We as homeopaths also are not aware, because it is not supposed to be conscious. It is unconscious, and it unconsciously determines us how we are as human beings. It creates our individuality. So our individuality is in our programming. This program is very important. And that program is in our unconscious. And this is where I started all these theories. And then there were many people who helped. First and foremost, I was very impressed by Shankaran, and the reason being that he was the one who started this psychological approach. He came up with this part which was not so much emphasized probably, or people didn't pick up, but the situational materia medica. Somebody becomes like this magnesium because he's in an orphan-like state. So it was very nice. It is like imagining this sort of a situation produces this top of. So I thought the approach was very psychological. His first book, Spirit of Homeopathy, in which he was explaining certain remedies, profound. It was something amazing. So that was a very, very impressive beginning. So then I said that this is a man, if you read many other books, they can be pretty dry because it's there, you don't understand. So much of that, so much of materia medica, but I don't understand the person. It's like I remember I was asking Shankaran, how will I know lycopodium? What is in essence a lycopodium? Or any remedy? And I had this fortune of sitting with him and just seeing how he sees, perceives. And he's very psychological minded also. You see, in Soul of Remedies also, he has come up with 100 remedies, which he believes that if they are the most common remedies, if you know those 100 by heart, most of your patients you can treat. And he has given the complete psychological makeup, how Illumina is when parents are in control, how Ignatia is. So it's amazing. So that was my journey. Am I asking or I'm just continuing? And then came our dear friend Jan Scholten, who came up there with that first book. And that first book was about first time periodic table was explained in terms of ages, developmental ages. So this is something which is very resonates with me. And I was very happy about it. And then I was a time, I could know that this is a infant line, this is school age, aurum is in the king series or the adult stage of development, strontium is in the adolescent. And I also a lot contributed in our group with Shankaran about this womb. The stages of womb development was a lot because of what I had shared. All these lithium and boron and beryllium and all those remedies. And how each one represents a part of your development in the womb. And then natrum line, how we can explain every stage from natrum to magnesium to alumina to silica to phosphorus. How parenting changes, or at least your perception of your parents change by the time you're muriatic. So for me, it was very psychological. But till then, I didn't know. I liked it because it was developmental. But this developmental stage is the inner age. So when I say I could be an infant, I might be very emotional, I might be indecisive, I need mother's care and love. So what I'm talking about is the inner age. So whether they knew or not, it was in a way the whole materia medica, or not materia, the whole periodic table was understood in terms of developmental stage. Means I could be 70 years old, but I could be internally only 20-year-old. I could be an adolescent. I could be somebody like a baby in the womb. So this struck me. So in there, we individualize a patient based on his level of individuation or development. So this was very interesting. So for me, it struck me so much that I started giving too much of minerals. because I understood minerals psychologically, but I did not know how pulsatilla is different from any other plant developmentally. And then came the Yakir's chart. That added another dimension. And then I felt the missing link is the animal chart. So there I brought up with the animal chart. And then with that, the whole thing was complete, Then I got into the whole idea is this is the beginning of the PEM, Personal Evolution Model. I could have said no, individuation model. I didn't want to say individuation because Carl Jung's system is called that. So people who are psychologically minded might mistake and there would be confusion what we are talking. So I had to coin this new word, personal evolution model. The whole idea is that when we talk to the person, he may be whoever he is at the biological age, but from which age is he coming?
Yes,
And this was very important.
I mean, you did a lot of work with an animal.
Your voice is getting cut, Mike.
Okay.
I can hear you now.
So maybe you later or now, whenever, because you brought the animal chart into homeopathy, very detailed. I remember, for example, when you were talking about the mollusks. My God, every step in the evolution was mentioned. So maybe you can also give this example. I don't know whether also could show the chart or just, to that people get an idea with the mollusk, maybe if you want. We can do it with other animals also, but I think they showed nicely, and I know that you're very experienced with it.
If you want, I can show you the chart, but the whole idea is that within the mollusk also, there are a lot of mollusks based on development.
Right.
So let's say, for example, bivalves are the most early stage. Yeah. And then because they are in the shell. Right. Then the second stage is now when they want to come out of it. And then you have the stage of gastropod. And third stage is where you don't want the shell, I want to be outside. And instead of being the protection of the shell, you use speed and camouflage for your protection.
The sepia, no?
So that develops like sepia. As an example, it could be squid, it could be nautilus, it could be octopus. So, and then within each, how will you different a mussel from a clam, from an oyster?
How do you apply it from the patient? How do you apply it from the patient? The patient comes, let's say he needs a mollusk. How do you come from the symptoms from the being? I think one very important thing is that with this method, we can also go by teams, no? Before we only had a sensation, deep sensation. Now we can use the teams in the life of a patient, which makes it much easier, no? Because everybody's telling about these teams anyway.
Yes.
So how can you translate
it? Easy, we don't have to go deep till the level of sensations. I go deep till I get a sensation, but if I don't get, I'm not miserable. We can do even without it. So even whatever they talk, everything patient talks is from his state. So even if he's going on talking about his mother-in-law, it doesn't matter. We have to not say, oh, it's a human story. Why does his consciousness, why does his vital force pick up that as an issue? And why does he talk? So one beautiful part of this is the age will be seen at every level. Another important thing about his inner age is it will also explain to you the sensation. So when I say something explains the sensation, that means that which explains is a little higher level, not superior or inferior, but a stage above. Something above can explain something below, no? For example, let's say Ignatia. Ignatia is very adult, very responsible. It's very reserved. Even when there is some bad news, she will not cry. Weep cannot. It means she's a very adult, very controlled. But when something happens to the family is the issue of the infant. Then what happens? She suddenly collapses. Now I can say in Loganesi, we have the sensation of collapse. Now it is just by hearting. Loganesi, collapse. Malleolus attached, detached. Piperacy looking for excitement. Okay? But when you understand it from inner age, then you know exactly. Because Ignatia has two aspects. One side, it's like the two sides of the coin. One side, she's an adult. Other side, she's an infant. So she's very responsible. But something happens to the family, the coin switches, and she becomes an infant. And when you are infant, infant means before 1 year. If you make a child who's 6 months old stand up and you leave the child, what will happen? Child will fall down because the muscles are not developed. So can you see that collapse is because she goes to an inner age of an infant where the muscles are, she's helpless and the muscles don't function. Now I don't have to by heart collapse. For me, collapse can be understood because it is an infant. So infancy is an important, infancy explains the collapse.
Just to explain, the Loganacea, they're all in a development, they belong to the infant, no?
Yes, they are in an adult stage, yes. Infant in an adult stage. So they have double stages. Similarly, animals have multi-stages. So another way of knowing the kingdoms is the case very simple about one particular issue or two issues or multiple issues, like an animal. So we say, no, simple to complex. So even if I don't get the survival issue or I don't get victim-aggressor issue, even then I can come, when I see that their case has many dimensions, that itself, a complexity of the case tells me it's an animal kingdom. Right. So certain things come with experience and knowing and applying these things in our practice. But this is very important. So there are many ways you can see the kingdoms. So idea is the sensation, like for example, attached and detached. Chocolate. Chocolate is very much like natrum. So one side you are attached to the mother, but like muriatum, you are also detached. It is like that porcupine, the mother showing her the nice mothering part and then shows the hard part. So natrum has two aspects. I want that person, I'm very possessive, at the same time I can be hurt and I want to be autonomous. Now this combination you will see in chocolate. Chocolate is also toddler autonomous and is also an infant. So as an infant wants the person whom she is in love with, whether it's the mother or her boyfriend or whoever it is. And other side, no, I want to be independent. So you can see, now you understand attach and detach in terms of parenting, mothering, mother-child relationship. So when you have the context, then you understand what is attached and detached. It is not something which is attached to something and detached. It is not that neutral. Attach and detach in context with is the mother-child relationship. So everything you will see, all the remedies you can, all the kingdoms you can understand that way. Piperacy. Piperacy is just born. So when you're just born, you are bombarded with sensations. All your senses are functioning. Because you connect to this world through your five senses. Right? Child, you show something colorful, you put a jingle. These are the things which... So the child is like fluoric acid, Oh, you go to a new place, you go to Las Vegas and you want excited, oh my God, I want to see this, I want to see this. That sort of excitement is of just coming into this new world, and that excitement is what you see in Piperacy. It is like, that curiosity, wanting to know, experience everything, enjoy, or rather say, you want to taste life. Taste life through all the five senses. So, when you understand the development, now when I know it is like a child just born, then I can understand all the sensations. So, inner age explains sensation. Right. Sensation will not explain inner age. This is what we remember. And so we don't have, very often what we happen is, we have many systems which we use. This is a problem because when you have a science, you have to, what we say, an underpinning or something which is the basis or the foundation over which you built your premise. So there has to be one solid thing over which you built it. So here we have the inner age. So when you say individualize, you cannot have three methods of individualizing Because if you do three ways, one for plant, one for mineral, and one for animal, like plants, I will see sensation, otherwise I'll see this. Then what happens is, it is very important that I know my kingdom correct. And it is not that easy to know whether you are a mineral, plant, or an animal. It is very difficult. And when you put everything on this one thing that you have to know, is it a mineral, plant, and animal? There becomes a problem. So, because how many of us really know? I take cases of some homeopaths and then they ask, at least tell me which kingdom I belong to. You see? Though we know so much, we still don't know this particular aspect. So this is it.
Mahesh, I just wonder whether the listeners now have the question, where's the analogy? How did we get to know that, for example, Piper metistica is for newborn, Loganacea is, in the adult and in the infant? Where does it come from? How do we know this? It's a map, but from where does it come,
See, it comes because it's like you go to a school. Let's go that we go to a school. All the children are there, from the kindergarten to your matriculation. All are in that one building, in one school. Now they're all in the same school, but are they studying the same lessons? Somebody is in the 10th grade, somebody is in the 6th grade, somebody is just beginning. So we as humans also have come to here in this world, and one of the things we can say is not just for fun, but also to learn something. So if we see it as a school, then we are all here together, but we are studying in a different school. And how do we know which class you belong to? Based on your syllabus, what you talk. If you say, I know ABCD. So I say, okay, so then I know you're from kindergarten.
But why is Piper metistica like a newborn? And why is Ignatia like an adult?
Because everything in this life is evolving. There is evolution. So you bring it to another point. If you see trees, before there were those ancient trees, they were before there were the seedless plants, then the seed plants, there were no flowering plants. That is the previous generation. If you see our Yakir's chart, it does not even mention. There is no Lycopodium, no Thuja, there is no Equisetum, there are no conifers. Huh? There's no cycads, there are no ferns. Because they were the previous generation. That also work we have done. I've done a lot of work on those ancient plants. Forget that. That is not important. So if you see from first time, the plants which came up were not so developed. And with time, they evolved to better and better and better way of functioning. Till what we have today. Today, when you have the last is the composite. Now, composites are so small, they are like shrubs. You can even walk on them. And the trees were very huge, those ancient conifers, Sequoia, Gigantea, and all those, some huge trees. And what are these tiny little with small flowers, asterides lying down? But they are very complex. In the phenomenology, if you analyze them, the way they function, they are like many flowers in one flower. They are working in collaboration together. It is highly very modernized pattern. For example, when we were I remember in 80s when we had those computers, such huge computers. We had to plug it into the telephone wire and then it would work. Oh my God, one email means half a day gone. And then there were nothing, there were no functions. Probably you would sing a song or maybe paint or draw something and we would be very happy. Oh, I can draw and paint on it something. And today, the computers are becoming smaller and smaller, yet very multifaceted. Lot of functions. And we go on adding more and more. Every time Apple comes out with something new, they will have one more function and they'll tempt you with your advertisement. This is what we give you now. So you see, they become smaller in size maybe, but they are very compact and they are very efficient. So also the level of efficiency. So this is the skill we have to learn. So when you follow this method, then we learn how much you are developed, how efficient you are, how much you can cope in life, what all you can do, what produces stress in you, what does not. It is not something very difficult. Once you start, it sounds like, oh my God, how will we learn all this? It is not. There are basic 9 stages of life. If you know the 9 stages and how you are at every particular stage, it's like a school, no? There are how many classes? Maybe 10 classes. You have to know the syllabus, little bit of each class, and you know every child there. So these are the 9 stages of development which you know. So what this inner age is, we take evolution. Evolution is not of one person. Evolution is all trees over time. Human beings, we were in the forest, then we came into agriculture, then we came into industrialization and wherever we are going. Okay? So, as a mass we are going, and that can be compared with a human who goes through in one life. This is called development. What I go through is infancy, toddler, preschool, school age, adolescent, young adult, late adulthood, old age, finally very old and die. So what I go through, this is development of an individual. But it is compared, it is similar to how all the trees go over time. That is evolution. So that's why you have to use personal evolution. Evolution is always collective. So to make it to you, you have to make it personal evolution.
It's interesting, no? Because homeopathy is analogy, no? Similarity.
Yeah.
So there is
Yes.
it means that the evolution corresponds to the strength of the ego, right?
Yes. Evolution tells you about the ego strength. It's all about knowing ego strength. So a lot of this I have explained in my first book, Foundation book, which is the foundation of PEM. So this is what we do. So in minerals, we did development, but in Yakir did evolution. So what I did is from evolution, I made it individuation. So I explained all those 6 stages from developmental perspective, which she could not because she didn't know so much about the mineral kingdom. So I translated and did it that. And then on similar lines, I did also the animal chart.
Some people ask whether this PEM, personal evolution model, can only be applied with psychiatric cases.
It is interesting. I'll tell you why. Again, to quote Shankaran, I remember we were traveling somewhere and he said, oh my God, never get into those mental symptoms. Because there are a lot of prejudices there. You know, how you interpret a patient. You hear something, you'll say, oh, this is this. It may not be that. This is your interpretation of what patient says. Suppose I say I got pain in my temple, which is like shooting pain. What interpretation will do? There is no interpretation. It's very clear. But in mind, your prejudices, your perception plays a lot. So he said it is like going into the ocean without a compass. You will be lost. And I agreed with him. And there's a reason for it. The reason for the mind being so vague is that if you see our repertories, body is divided into so many sections. Our body is divided into so many sections. From head, eyes, nose, throat, here, there, everything. Extremities. Mind is one section and mind is bigger than the body. But mind is one section. And me being a psychiatrist, I had to deal with mind. And there was no mapping, whereas mapping is available in the body. Body is mapped. Right. And what we say, whenever a patient comes, we ask 4 questions, what is the location? What is the sensation? What is the modality? What is the concomitant? In the mind, where is the location?
Mind.
If I come, Mike, I come to you and I say, I got pain. Your first question will be, where is the pain? I say, I won't tell you. So you say, go home. I can't treat you
Mm.
because I'm not giving you the location.
Yeah.
So in mind, there is no location. How will you treat? So these maps help you locate. This is where. And then you zero down there. So location is very important.
So
So what you're saying is, hmm?
the teams are the location.
Yes, what a patient talks, his issues, more than his issues. Whatever the patient talks about and where is his level of development, that will tell you the location. Is he talking about infancy? Is he talking about adult problems? Is he talking about old age issues? Is he an adolescent? So that will help you go where. And also advantages, then you can have correspondence. If he's a plant, it could be this. And similarly, if it's a mineral, it can be this. And if it's an animal, it will be this. So you also have a correlation. Like I had a patient who was brought by a homeopath and she had given nitricum in every possible way and nothing was happening. I just gave cactus because cactus is corresponding plant and it was a miracle. So you can just see she had done all the homework. She gave me the history. I said, I'm not giving mineral, I'm giving plant because there was more sensations and sensitivity. And the magic was done. So there is correspondence. So you know. So now all of them are in the same pattern. Animal in the same pattern. So your question still remains. Psychological. Now this was the missing link. So first of all, psychology, most of us first of all dread, oh, psychiatric case I won't take. Schizophrenia I will not take. Oh, bipolar I will not take. We were dreading as you began telling me that now you feel more comfortable taking those cases. So psychological is important. Only the entry point is different. In a physical problem, I'll go through your physicals. Okay, you have pain, you are feeling stiffness, it is better by movement. And then I'll put all that in repertory and I'll get 5, 6 remedies. Then I'll ask, tell me about your nature. And out of that 5, 6, what is the developmental stage which fits into all of them? I can pick. So you first start with your repertory, your physical, LSMC, and then you add psychological. And in psychiatry, you straight away go into the mind. Now you're not afraid. Because very often they'll say, I have no physical problem. I have only mental problem. Then what do you do? And you can't just take on some cravings and I'm hot or cold, or I don't drink too much of water, or I crave fish, an aversion to milk. That is not enough to give me a remedy. So generalities may not help us enough, and they may not give you some physical complaints or some specific things enough to locate. And they're not interested in talking. The person is talking about his problems at work, and you will say, no, but tell me your physical problem. Right. So it also is not good. So you enter there, and then if he has any physical, that will be understood. And so I've got many people now. I have many people who are following this method in India. Most of them are not having psychiatric cases, but they're using this. And they're presenting cases of pathological cases where how PEM has helped them. So it definitely helps. But that could bring another point which I could tell. And that is my latest edition of Chakra system. And that somehow brings everything together. Because
Mahesh, may I first ask a question? Because I think
this we'll talk later. We'll talk later if you want.
You come to
but
this is what I want
to
know is when I'm a homeopath and I listen to this now, I think, oh, do I have to change my method? Or can I use it complementary? Can I work as before and use it complementary? Or do I have now only to learn this method and have to forget everything what I know,
See, listen. First, when I do PEM, PEM doesn't mean do I do sensation method or PEM method. It cannot be. This is something from sensation method when I've come into this, and I've come into one system which helps you in everything, but it is an umbrella. Sensation is included. You'll see millions of cases. Like last time I showed you in MWM where I did repertory and I came to Corvask. Yes. You don't remember? So you don't lose anything. This is not rejecting anything. You use Jan Scholten, you use Yakir, you use Rajan, you use Jan, everybody. Repertory. Whoever tells you, repertory. Everything. So it is an umbrella. And if it is the eternal truth, let's say if this is the truth, then it should explain everything. It cannot reject anything.
Yes.
And another thing is, I remember before when I was only doing the sensation method, I would teach and then I would ask the students, what do you think? Everybody would come and say, this is the kingdom and this is the miasm. This is the kingdom, this is the miasm. So what would happen is these two are the most important. Are you getting your kingdom right and are you getting your miasm right? And based on that would be. Whereas with this method, it doesn't matter. You don't have to pick anything. Take what is very sure in the case. If you have a keynote, take that. If you have a sensation, take that. If the inner edge is clear, take that. So whatever is coming to you, you take. So it is very inclusive. It is like, you're taking a toolkit with you with your car and you're going to Italy or wherever you're going on a trans-Europe trip. So you don't know, you're not going to say, I'll only use the screwdriver. You will use whatever is required. So that is the beauty. You have more flexibility. You are free to do whatever you want and you're not stuck with anybody. In my group, today I had a group in the morning. I just finished, in fact, just little by time before. Everybody is allowed to speak anything. One fellow will tell, I did it by repertory. Somebody says, I found a sensation. Somebody says this. Everybody is allowed to speak everything because it is inclusive.
Right.
When I say chakra also, it's an add-on. When I say chakra, doesn't mean leave everything. When I say animal chart, doesn't mean leave everything. It is bringing in one more dimension, which is adding much more. It's like beauty. It's like, you have already made your dish. I'm telling, add a dash of this. It'll make it very nice.
So
It'll
now,
become more flavor.
I want to mention that you just finished your book, and it's a real monument, I think, with, I don't know how many pages, 600, something like this.
More than 600.
So it's all about the chakras. By the time
yes,
I can see it in the lectures, the chakras are getting more integrated. So this is also interesting because this is new, in homeopathy. But it's an universal law, no? It's not something new.
it is universal and many people use it.
Yes.
Acupuncture, acupressure, crystal therapy, color therapy, name it. Many of them use.
So this
is a truth. This is something true. So these centers, why I found it interesting? I found it interesting is because our medicines are energy based. You dilute, you bring it till you have only the imprint of that particular substance. It is like, that energetic pattern of that substance. You don't have material. It is not material. So we have a system. We have a physical body. But we also have an energetic anatomy inside us, which has no location. You will go and I'll tell you, my fourth chakra is in the heart. You open your heart, you will not see any chakra there. There's no chakra there. These are energetic fields. There are many energetic fields, but these are 7 major energetic fields in your body. And whether you like it or not, our remedies work on these energy fields. So if you know energy fields of your body, what is it? Nothing better than that. And every energy field, these are like 7 cities within you. Every city has its own flavor. So let's say, and every center has covered certain physical aspects. So if I have a problem with ENT in my throat, I know it's my 5th chakra. I have some brain problem, schizophrenia or something, I know it's my 6th chakra. If I have urinary tract infection, I know it is my 2nd chakra. If I have digestion problem, I know it's my 3rd chakra.
Easy.
So you see physicals.
Right.
Then it also explains your outlook towards life, how you see. Because every chakra brings with it a mental state. Your preoccupations, how you see. It's like your lessons for this world. So you're only going to talk that because it's your program. Somebody is only interested in share market. Somebody is so much into psychotherapy and healing and homeopathy like us. Somebody is a politician. Somebody is an artist. Where does this come from? It's all our chakras which program us in a particular way. So what I see chakra system is, first of all, it is directly our energy system matching with our energy system within. And also it brings physical, mental, emotional, and spiritual part,
Mm.
which we need to bring about. Sometimes patient can ask you, what is my meaning in life? What I really need to learn to get better? B.C. Louisa Hay, many of these books nowadays, every illness is speaking to you.
Yeah.
So it also includes this dimension. When some sickness comes, you are able to tell your patients, this is where your block is, and this is what is going to help you to go ahead and be more flowing and not get so stagnant in life and evolve as a human being. I think you all who have come here in this world have to have a little bit of personal evolution. We cannot go back from this world the way we have come. So if we can give a remedy which helps him become better human, a little higher up the ladder of his evolution, I think that is very important. So it is very holistic. Once you do chakra system, it can help you. It can also help you understand your patient. So this method is, one thing about this method is that it is no more a blind procedure. At one time, Hahnemann came up with this big idea and the wonderful idea and something profound, but he was just beginning. So how do we do it? What I do with this material? Then he came up with repertory. But it was a blind procedure. Take this rubric, this remedy comes. Now with so many years, we are able to understand. I can understand pulsatile. I can understand what is a lac equinum or lac ovis. I can understand what is a mineral. And you can understand in terms of, as a human being, what are you here? What are you doing? You also incorporate all the 5 elements which we are made of. Are you predominant earth, water, fire, air, or ether?
Yes, you included the elements also. So just tell some words. What does it mean? How can we recognize the elements, the predominated elements?
It is because each chakra has a predominant element.
Mhm.
We have the first chakra, which is earth element, then you have the water element, then the fire element, then the air element, then the ether. So it is becoming from gross to more subtle. And as you become subtle, you're also becoming subtle in your being, in your existence, in the way you are. There is more freedom, there is more space in you.
Hmm.
So it all depends on that. That is all once you will start learning. I don't think we should start teaching here. But air quality, like for example, we'd like to be free. Even if you keep air in a balloon, after some time it will get out of it. So air cannot be restricted. Air needs freedom. Ether means a little bit of spiritual quality, feeling of oneness with the people around. Okay? Water has to do with emotions. Earth has to be with the foundation, your grounding, the solidity, the stability in your life. Fire is the one which makes you act, to move. I can just give you one few hints like that, but
Well, that's
it can be understood.
it's so that people can understand, why is it
Yeah.
all? It's very interesting.
I tell you, it sounds, when we talk like that, it looks like, oh my God, too much of studies. No. So many people are doing, and once you have these basic ideas, these few ages, as I said, 9 stages of life, if you know, then you have to apply that same thing in your plants, in your minerals, in your animals, and same thing is applied in the chakra. So what I have added to the chakra system, which I can say is my contribution to this immense knowledge, is I've made chakras also into the inner ages. And then there are cycles. You have a womb cycle, childhood cycle, adult cycle, and an old age cycle, where it is that you go through the cycle of all these chakra not once, but 4 times in your life. Up, up, up. So it's like, in one lifetime, you get chance of experiencing all these 6 chakras 4 times. And at every time, there's a different story. And you are learning and mastering yourself through them. So how to see them in terms of inner age is very interesting.
Yeah, makes sense.
And how to apply it in proper.
Mhm. It's a spiral now. We make this similar experience, but it's different.
Yes.
Very good. So,
And that's why in the book also I've given about 12 cases illustrative, where I've in detail I've explained how you can understand chakras. So people will get an idea, and people who are interested then can do a lot of things. Like, with you, I'm doing so much of these lectures. So there are many ways. Once you like, then there are many ways of learning. I'm also planning now to come up with books only of illustrative cases after cases after cases. So people who are interested can just go on reading them, and very gradually, without you realizing, you start learning and be able to apply in your.
I mean, we also offer this, this introduction to the chakras, introduction to the PM, so that people, if they are interested, they don't have to visit everything. They can just start with an introduction. No, I wanted to say.
Exactly.
And yes, and you have written more books, no, than only this.
Yeah.
Just tell some words about your books.
So one is the foundation book, which has to do with my whole ideas of PEM. There are some illustrative cases, and I've explained the plant, the minerals, the plant kingdom from PEM perspective, and the animal kingdom, and also a little bit of spiritual way of how do we see life, how we see human beings, a little bit of that. And then there are many cases also. So first is you are getting introduced to all these charts. So that is the foundation book. It's like if you want to follow this method, you need that book. Then because I'm also a psychiatrist and I'm also University of Mumbai, a university which is a government recognized course. That university gives me every year 50 students to train them for fellowship in homeopathic psychiatry.
Wow.
At the end of which they have to write thesis, and also they get a degree. It is called FHPC, Fellowship in Homeopathic Psychiatry and Counseling. So which they can apply and put it as their degree official degree on their, that is for homeopaths. So I'm training them. So I teach a lot of them because it is a psychiatric course. So I came up with another book called as Desktop Psychiatry for Homeopaths. So there, all the psychiatric illnesses have been explained from a homeopathic perspective. I have not used the usual classifications, which only allopath. Because if I get a panic attack, I'm going to see it differently. Why should I buy somebody else's method, which may not be applicable to us? They are thinking biochemically. Then if I get a case of, let's say, bipolar, if I get a case of schizophrenia, how they will explain and how I see schizophrenia is very different. So how a homeopath would see by which he can come to what sort of remedies. And then with each classification, I have given what sort of remedies will come. So it's a desktop psychiatry. It's also not a small book. So it's like if you get a panic disorder, you can open and just see if it's a plant, what sort of thing can come. If it's OCD, what sort of things can come. So that is called desktop psychiatry. Then another book on panic and anxiety disorders. And then now this book is there, which is the chakra. So these are 4 books. And now my students also are helping me because I've given many lectures on mollusks, on various butterflies, on mammals, on felines, canines, monocotyledons, ancient plants, and many, many more things. Whichever I've done, reptiles, birds I'm doing right now. So all these, they're helping me to come out because I can't do all this in my life. Otherwise, I can't give lectures, I can't practice. I would have not been able to write this last book. So now they said, you don't do it, we will do it, and from all your lectures and try and come out with the book. So there are 2-3 books which are on the way, which people are working.
Very good. Very productive and helpful for all of us.
No, because they say, because when you teach, somebody, if I will tell these cases of pectin jacobius, they say where to read. I don't know where to read. Right. So if that book comes out, so they know, okay, we can read this book because there we have information of it. So right. Sometimes we talk about some remedies, but they don't have access to any particular book where they would get that information. So it is important that those books come out.
Very good. So much. I think we come to an end. Just one question comes to my mind. How can lay people, not therapists, also have profit from these ideas? Can they do something? Can they learn something for themselves?
I think very much. Like, for example, my last book, I have an idea. I'm going to remove all the homeopathy aspects of it and make that whole book for common man. And it's very important that we sell our idea, how we do homeopathy. So far I have not worked on that, but it would be very interesting, no? How we see, how the human beings are, what are these remedies, how we make, what changes it does. Because we are the connecting link.
Mm.
You know, psychoanalysis and psychiatry have divorced. We have found a middle way.
Right.
We give medicines, but not those medicines. We give energy medicines. But applying all this, whereas psychiatrist has nothing to do with what Freud has done or what Erik Erikson has done or what Carl Jung has done. It has nothing to do with it. Whereas all those aspects, the shadow, the Erik Erikson's different stages, the Freudian work, all this, we are using it in our practice. So in a way, we have what they were struggling to find a way out, how to use it. That answer is in homeopathy.
Mm. Very
I
good.
think all the great masters who have done work have actually helped us.
Very good. Thank you so much, Mahesh. We have just
Thank
an
you.
hour, exact 1 hour.
My God, it didn't look like it was 1 hour.
In this hour,
Huh?
we covered everything. I think it was very nice, and people will have really a lot of information to go with it. Thank you so much.
And my best wishes to all the participants and wishing them best for everything in life. Okay.
Thank you so
See you
much.
all.
Bye bye, Mahesh.
Bye,
Bye,
Mike.
everybody.
Thanks for inviting me, Mike.